Welcome to Psychic Holistic Spotlight of Rhode Island. I'm Kathy Carson, your host for today. We also have Josie Ray and Bill Hannon co-hosting with me as well. And we have an interesting character, interesting person, I should say.
Character's right.
I didn't mean to say character, though. Usually
yes.
signifies a bad thing, but in this case, it's definitely not. He does something a little bit different today. Well, for what he does, it's a little bit different than most of the people that we have on. His name is Fred. He does a lot of sound therapy, and it's a variety of a couple of different things that he does. We met at a fair that we worked at a while ago in person.
Yes.
We connected online, though, as most of us do these days. Previously to that, though, and I think we just had a couple of questions about, being teachers, ritual teachers, and some stuff that we do. So let's talk about some of the stuff that you have on the table. Right. I just want to ask 20 questions about it.
Oh, certainly. I was going to say, as I mentioned previously, I said I had gotten into sound healing therapy, and yes, it's something that I resonate to. Yes, pun intended. But what I have here is a number of different things. Where first I started off with Reiki. And when I give presentations, typically I wind up, telling people, hey, you refer to it as a gateway modality, where, from there, a lot of people will leapfrog on to other things. Myself, I'm actually certified as a Reiki master teacher in both Usui Holy Fire 2 as well as Kundalini Reiki. Oh. And from there, I started off. What caught my attention at one expo was biofield tuning. And that was developed by Eileen McCusick, and that's really to take suppressed traumas, comb them into the chakras and release. And it's part of a suppressed trauma release. And with that there, now one of the tools that we have is what's common is an unweighted tuning fork. A lot of people are familiar with that because it's just like a piano tuner. You strike it, and you get a tone. So whether you use it for tuning a piano or such, but what I really like using is something that looks like this. These are weighted tuning forks. Now with these weighted tuning forks, when you activate them, there's little or no audible sound. However, they vibrate wildly. It goes down the tines, down the tang, out the end, and with that vibration. Sometimes you'll see these in a older doctor's office or a surgeon. And these are also known as auto tuning forks, which is short for osteophonic, which actually means bone sound. Oh. They would actually use that with, in the case of, let's say, for instance, somebody comes in and there may be a suspect of a fracture. So they take that, and actually, if you put it on a bone, you can actually, by having it here and of course having the other hand, you could actually feel the vibration going up the bone. And if you could feel it going so far and say, whoop, something stopped here. So, okay, so now we go over here. And now you can feel it going down and it stops there. So guess what? There's quite a possible fracture. That's a diagnosis without doing an X-ray. Still need that, but it's like, it's a cursory check. Yeah. So that's one thing. Another thing that I use is obviously the bronze. The controversy is the proper nomenclature, whether it may be Tibetan singing bowls, Himalayan singing bowls, but basically the bronze. Bronze is made up of 80% copper, 20% tin, and you can strike it, you get a tone. But what I've learned, and what my healing guides that taught me, is actually to use it in a non-conventional way, where you could actually put it up against the body, and if you strike it, how shall we say, with a bit of flourish, it just sends a wave of vibration that just permeates the body, but yet gentle. And again, it's like smoothing out frosting on a cake.
Each bowl has a different tone.
Oh, absolutely. Yeah, no, each bowl has a different tone, as opposed to. So it depends on the size of the bowl. It depends on a lot of things. How it was manufactured. What I have here is more the antique hammered bowls, And what I love about bronze is that it has all kinds of wonderful undertones, overtones. Like for instance, we could take the large bowl here. You get this almost like a drone, but yet you can. And you get overtones.
And yet you can still hear the bottom, the first strike.
Because it's now that's something that's unique to the hammered bowls. You take something like a cast bowl. Actually, you take a cast bowl or a machine bowl or a crystal bowl. Crystal bowls are wonderful. I even have a set. However, they're also monotonal.
Okay.
So you strike it one tone, that's it. They also have a nice long sustain. Where typically bronze bowls like this, have a shorter sustain. So that's
Now,
those are the
is
tools.
this a full set though? These bronze bowls, or is that more?
Oh God, no.
Okay, how many is to a set?
Well, it depends how big of a set you want.
Okay. Okay.
Like myself, I got my foot in 2 arenas. One of which is I see individuals. Not in my practice, I see individuals, and so does private training. Private treatment. But then I also have another foot in another realm where I also do group sound meditations and things of that. And so it's like actually I just did one at an expo yesterday at the end, and on my setup there I have 13 bowls set up. Now I mean there's different purposes. I got some that are actually paired up so they can harmonize with one another. And I mean this bowl right here, this is a 12-inch bowl, and this is my honey from the start. But I now have quite a variety where my smallest bowl is only 2.5 inches in diameter, and my largest, which I just picked up recently, is a 20-inch bowl. So wow. I mean, what's awesome is I do this at my practice as well as at wellness fairs. Have people step in it barefooted or in stocking feet, whatever. I mean, I can do it. I got big feet, but you stand in it, and then when you strike it, there you can feel that vibration coming up. And then I have another 16-inch bowl, which is a little bit smaller, but with that the vibrations you can just feel it. So it's like getting a sonic shower. So it's
Interesting.
Now you mentioned before, you had a setup so they would harmonize. Give me some insight as to what you mean harmonize.
Oh, okay. The harmonize is really. I'm not a musician per se, but basically what sounds good together. Like say you're playing a chord, so now you typically like whether it be a G major chord or whatever, it'd be like every other note. But you could take two, but you can have some bowls there. It's like okay, they don't sound good together. So it's like basically like harmonizing. It's like okay, you can get a couple of people. There's some that actually mix nice, and others that it's like So it's it's just a matter of what blends nicely. So
right. Okay. Very good.
So there seemed to be some learning though with this as well though too when you first got these bowls.
Oh God, yes.
Yeah.
I've been at this for 5 years now. Like I said, I started off with Reiki, and then I went to biofield tuning, and when I wanted to go for my certification as a certified biofield tuning practitioner, it's like I needed to save up for the tuition. So what I did is I started going into Tibetan singing bowls because the cost of that course was less, and it just kept growing and growing and growing. I mean, I'm always learning, as it is right now, and I love this. Where actually under my belt, I now have 12 different modalities.
Wow.
And and so what is great is like I mean, it's one thing maybe when you're first starting out, you have maybe 1 or 2, and that's wonderful. However, it'd be like, okay, you open up a toolbox, and inside is a hammer. Well, you can use a hammer to drive a nail. You can use a hammer to drive in a screw, though a screwdriver is better. But what I love is to be able to like before I work on a client, is that maybe have a 1, 2, or 3 minute consult. And it's like, okay, what would you like me to address? Because what's wonderful is with the different modalities I picked up is that I can address not only the physical, but also the emotional as well as spiritual. And so in a way, it's almost like going to a Chinese restaurant where it's like, okay, while we're sitting down, I'm already customizing this and getting input from my guides, where and so it's like, okay, so here's kind of like, okay, we'll pick some from column A, some from column B, and we'll actually customize the session for the time allocated. For example, let's say somebody could come in and it's like, oh man, my hip is killing me and I'm feeling anxious and depressed. Hey, we can do it all. Within
One-stop shopping.
Exactly. I'm not saying that I'm not saying that it's like I'm the end-all, do-all. Oftentimes there are, I may have clients that will come and it's like, okay, I can work, it's not really effective, but wait a minute, there's somebody who does such and such a modality. I want you to go see them. So it's, because I mean, let's face it, in the universe, there's plenty to go around.
And in the meantime, you're giving them relief for the symptoms.
Oh, absolutely, yes.
Right.
Yeah, because I tell you, there is nothing that is more satisfying, so satisfying, humbling, and gratifying that when somebody picks themselves off the massage table and goes, "Oh my God, I feel so much better." Thank you.
Yeah, to be able to help facilitate that.
Oh yeah.
So can you get into a little bit of the, you said, I believe it was biofield tuning?
Oh.
I'm not sure what that is.
Okay. Actually, I'll give a quick explanation as some little this, that, and the other thing. Biofield tuning is really where where the biofield aura, if you can think of it as the aura, there are certain traumas that get stuck there because or suppressed traumas, I should say, because let's face it, when something bad happens, the last thing you want to do is roll around in it. You want to take and bury that down as quick as possible.
Yeah.
And it's almost, and what I use when I speak to clients is also like, imagine, let's say you're walking on a boardwalk, and now you barefoot. And you get a big honking splinter in your foot, or if you're putting in a post, doing fencing, and now you get a big splinter in your hand or such. Well, you can pull it out, but let's say the little point or the tip breaks off, and what happens is, okay, it's like, well, that's rather deep. Okay, if I don't want to really slice myself open to get it out there, I'll just leave it. Well, what happens is a day or two could go by, weeks could go by, even months could go by, but then at some point it may start to get fester and get infected, and that little thing is affecting us physically. Same thing too with suppressed traumas. A point in case is when I was when I was going for my level 1 biofield tuning class. I was stressing myself out because that's when I wanted to start my holistic practice. And it was like, okay, where I'm going to go, how I'm going to do it, yada, 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 yada. And several weeks prior to that, my right ankle was buckling on me. And it's like, it didn't really hurt, but it's like, it got to be annoying. So when I went to class, we worked on each other. And so when it was my turn on the table, come to find, we use a pendulum to diagnose different trouble areas. Come to find out, okay, the trouble spot was my right ankle. Surprise, surprise. And what sticks with me is that the trauma that's
Associated with the
thank
ankle?
you. Yes, associated with that is next steps, where we're going and where we're headed. And so it's like, yeah, that makes sense because I was stressing myself out, and even after I got off the table, there is like, I was so concerned. But the thing is, it wasn't until a few weeks later, after I got off the table, that I was like, oh, hey, I wound up with that there. I wound up. It's like, oh, hey, it's it's not bothering me, and it's like. And it's like, oh, that was taken away. So it's like, that was just a little quickie example. Other things that I do, actually, I even have a modality that my healing guides taught me, and I got it trademarked. It's IVSB. integrated vibrational sound bodywork. And that's really a case of integrating the use of the weighted tuning forks, of using the singing bowls, on the body. I'm also a certified VFRT therapist. That's vibrational fascia release technique. That's one thing.
Okay, what is that?
Yeah.
What is that?
Yeah, I was just going to explain.
Okay.
Vibrational fascia release. Okay, fascia is, and this is what I love is the bodywork portion of it. Fascia is that like that clear membrane that's
thin
around.
connective.
Yeah, it's under the skin and it surrounds all the major muscle groups. Okay. And not only does it surround the major muscle groups, but it also surrounds our organs, so it keeps our guts from sloshing around.
Yeah.
It also surrounds our veins and arteries, so it keeps things in place. And what's really awesome about the fascia system is that, let's say, for instance, you have a sore shoulder, and now the body sees and senses that, hey, it hurts when it moves, so what it does, it puts out cellulose fibroblasts. And with that it's almost like a natural splint, so to help to mobilize it. Well, what happens is that the fascia system doesn't know when to quit. And so it just keeps putting out, and if anybody's ever had any type of laceration or surgical wound, you know about scar tissue. Mm-hmm. That's just a buildup of fascia. And so what it is with vibration is like fascia loves that there, where it's like taking a hot knife to butter. It just, like if you go for deep tissue massage, there it's tough on the client, it's tough on the therapist. There they have, everything is, you're like a frozen brick, and there they have to push through, and now instead of being, now the client's on the table, so now instead of going, their fingers are tightly gripping the sides of the massage table, the knuckles turning white. There was a point where I even worked part-time as a independent contractor for a holistic occupational therapist, and my job was really to soften and tenderize the clients before the therapist would work on them. And so they say, okay, go into that room there, and okay, spend 10, 15 minutes. Okay, this was a shoulder, a hip, a leg, a back, whatever. And so it made it easier on the therapist, made it easier on the client. So it's kind of like, really, makes it really nice. Mm-hmm. So that's with that's working with the fascia. There's also other little things. As far as like adrenal rhythm reset, is a subset of the biofield tuning, but on top of the kidneys are the adrenal glands, and of course its job of function is to pump out adrenaline for a fight, flight, or freeze, which is great. However, there comes a case when we come under stress, and we come under stress, and so what happens is that they're going to overtime, and here they're pumping out adrenaline 24/7, and so instead of being we're kind of and so it's a matter of like, okay, helping the person to cool, to quiet, to calm down, and that's another point. Oh, what's also I also do acupressure. But the thing is that I've been able to, now here's what's nice about having different tools, where I'm able to incorporate the weighted tuning fork, because with this here, this sends the vibration down. So now let's say there's a pressure point. It's one thing just to press with a finger, but now to press and have that vibration, it really
so it's like
accentuates
sending sonic waves through, and it's smaller, it's going to be more powerful.
Exactly.
How do you choose which of these?
Which okay, this again was I can thank my healing guides for that, where I found, and just from experience, that weighted forks, say at a range of 64 hertz, is good for working on soft tissue, whereas those in a range of 128 hertz is good for working on bone, because I've been able to successfully help and treat people with carpal tunnel syndrome, diabetic neuropathy, sciatica. Mm-hmm. That's always a pain in the backside.
Mm-hmm. Yes.
And so it's that in itself is pretty awesome. And the other foot that that's part of the private practice. I also, maybe just to quickly wrap that up. I also do gua sha, which is actually and that's kind of that's a Chinese medicine form where it's really scraping, breaking up fascia, and what that does is, besides breaking up the fascia, it also brings blood to the surface to increase circulation, and that falls under the premise of, and this here's a long acronym, IASTM, which is Instrument-Assisted Soft Tissue Mobilization, which this is also part of, and that's something I really love. Another area or phase that I have my foot in, and that is with group settings. I love doing whether doing a sound bath, doing a sound meditation. Basically, I got a lot of toys, and what it is really just to create a soundscape, to create something from meditative healing, where already with the brain, but naturally we're in the beta state, which is like, okay, active, where it's like, oh, shiny, squirrel, oh, did I leave the oven on? Things of that nature. To get down to the alpha state where, okay, a little bit more cool, calm, relaxed, but really to get down to the theta state, and that's the equivalent of REM sleep. And that's where the body could do its greatest healing. And so, I take it as the greatest compliment if somebody's on the deck snoring. It's like I don't get insulted.
No.
And it's awesome.
Actually, that's a badge of honor, because they trust you enough that they're so relaxed that they can just give everything up and you can do your work.
Exactly.
Right.
All right, so before we get back into another topic,
Sure.
how can people get a hold of you?
Okay, people can get a hold of me. My cell number is 860-823-8511. One more time, 860-823-8511. That's my cell phone. You can call me, text me. It's like a symbiont being that's always with me, so we're good.
Okay.
How do things work emotionally? You mentioned that you can help them emotionally.
Oh, emotionally. Okay, great. One aspect is the biofield tuning. Let's say they have suppressed trauma. So basically, to help facilitate releasing that, because as you comb through that biofield, you're actually there's a timeline where you go through, and so I may hit something energetic blockage. That and I'll look down because basically the outer edge, which extends 5 to 6 feet out from the body, is age 0 or gestation of birth, up against the body's current age. And as the person gets older, the field remains the same size, but the rings get tighter, like rings of a tree. And so I use Herkimer crystals. Just as just a mark on the floor. It's not super calibrated, but it's like, hey, it's like, okay, here's the outer edge, here's a halfway, here's a quarter. And so now as you go along, combing along the field, it's like, oh, I feel something, some energetic resistance, and okay, that looks like around, maybe age, 13 to 16 or whatever. And it's, in some cases that may bring, that may bring to remembrance, something that that somebody went through, or maybe it's nothing. And it's not so much that they have to vocalize, but rather accept, but recognize that trauma, thank you for the experience, and now release it. That could be a tough time because there are times other practitioners make fun of me. Is, oh, you always make your clients cry. But the thing that's all part of releasing.
Releasing.
Yeah.
And so all you can do is just be there for them, and that's what really counts and matters. So.
Well,
Sure, and-
everyone does their own healing, ultimately.
Exactly.
Right, and that sounds to me like a great way to access the emotional field. Because everything is resonance, everything is vibration.
Exactly.
Yeah.
And whether it's on an emotional plane or the physical plane or the spiritual plane,
Sure.
you're able to access it just by picking up that information. Right, that's interesting.
And another way, as far as maybe if somebody is addressing emotion, let's say somebody is just stressed and they just want to choke something. So it's like, okay, lay back, and I have a series of bowls. that I'll actually, start from the head and lay on the body, go down, and actually I'll do almost like an individual sound bath. And I just kind of what sound, music, that in itself is its own therapy, because when you consider that, hey, music itself, I mean, if you're feeling, there's certain genres that you respond to. I mean, you put on something something peppy if you want some motivation. If you're feeling sad, there's maybe some other types of music that pick you up. The motivational, no, I wouldn't suggest playing that at night because if you want to fall asleep, because now it's something more calm and sedate.
Yeah.
But it's just something to relax. And even, and again, I'm always learning, like, okay, I got tools, I got the bowls, I got drums, I got other sound tools. Matter of fact, I'm learning Mongolian throat singing. I won't do a demo because I'm not quite ready.
Versed in it yet, yeah.
Yeah, still learning, but it's like, that's one thing we've been given a voice, and just by toning and even if we just kind of go like a hum, and you feel resonance in your chest, and now just do that in a meditation. That's already doing your own sound healing to yourself.
And it's also important, they've done studies that the resonance of humming, especially something sustained and deep, releases the nitric oxide that your sinus cavities can actually produce the highest amount of nitric oxide in your whole body, which is extremely important for your blood, veins, and arteries health, as well as other things. But that right there is the quickest way to bathe the body with nitric oxide, and it helps actually prevent heart attacks.
Oh yeah. No, it's wonderful.
It's interesting, all these like alternative therapies, or we've been doing them once upon a day, we're just remembering again. We used to do this all the stuff before conventional medicine. We still need it.
Oh, we still need
But,
it.
it
Absolutely.
definitely comes hand in hand though for both. Yeah.
I tell you what, if I'm in a car accident, don't take me to the chiropractor. I mean,
Take you to one of these people.
right.
Yeah.
Well, the thing is that for acute situations, you want acute, but for the chronic thing, which is what we deal with mostly, the long-term, less, life-threatening issues, that's...
Yeah.
Absolutely. I mean, this vibrational sound body work, that can do wonders. I'm not saying it's a cure-all, but it's a wonderful. Actually, I'm also part of the Harvard Healthcare Patient Family Advisory Council, and actually my doctor invited me because of my holistic background. So rather than saying alternative medicine, I prefer the term complementary.
That's right.
Yeah.
So basically, I mean, you got a gash, you're gonna need sutures, but it's like but other care, so it's you just work it together.
Right.
And that's a great part, is actually complementary to work one another.
Right.
Yeah, I've seen that as well though too, the different the medical places.
Well,
I've
it's
seen both.
important to work with sound as you're doing, because sound is the last sense that we lose.
Interesting.
Yeah, before we pass away.
Oh, I didn't know that.
I
though.
didn't know that.
Yeah. Huh. That's a good thing though then, Have you ever done any end of care work?
Actually, I have. However, that was in the function of as a minister, so that was
That's
part
a whole
of
different
that.
thing,
That was
yeah.
a whole different thing.
Yeah.
But yeah, I've had experience with
Yeah,
in the life. Yes.
So what's the most common reason that people will come to you though to use one of these?
Okay, most common for people to come to me would be those who have aches, pains, body work. Those who are feeling that, or people who are feeling stressed, depressed. And in that case, I'm almost like there are times like I feel like a therapist. A psychotherapist, and it's because sometimes people just need somebody to listen, somebody to care, somebody to hold the space, someone to hug. And so that's the type of client. So it's almost like at the Statue of Liberty, it's a little plaque where it says, "Give me your tired, your poor, your wretched, those who are yearning to be free." It's like, hey, those who want a freedom from stress, those who want a freedom from pain, those who want greater mobility. So, yeah.
Do you see like all ages though with this, or is there like a
Oh, yes.
bracket? Oh, you do. So
Oh,
there's
I-
not like
I-
one more than the other.
Oh, I mean, no, I see.